Hi, my name is Jenny and I'm completing my community project at Nexus Primary Health. This video will give you a brief introduction to the structure and services provided at Nexus and an overview of the project I am undertaking along with Crystal, evaluating the strengths and gaps on diabetes service provision for people living in the Mitchell Shire. Nexus Primary Health is a community health organisation funded for the residents in the Mitchell Shire and surrounding suburbs. There are 4 locations, which are Broadford, Seymour, Wallen and Kinglake. Nexus offers a wide range of services such as medical and nursing, allied health, mental health and wellbeing, along with health promotion initiatives and community support and engagements. As part of the nutrition services at Nexus, there are 3 part-time dietitians, Michelle, Diana and Melissa, who work across all locations. Michelle works on Tuesday and Wednesday, mainly covering paediatric cases, such as children on the autism spectrum. Diana works on Thursday and Friday and sees all adult clients. Melissa's main role is unique as she does not see clients at Nexus, but will travel to surrounding suburbs and visit clients in their home. Unfortunately, none of the dietitians at Nexus are allocated hours for projects or health promotion, so the project sits outside of their primary roles. The project which we will be completing during this 5-week placement is a small part of the wider diabetes diversion program, which aims to decrease the incidence and prevalence of diabetes-related complications in the Lower Hume area. Nexus Health is working in collaboration with DPV Health, Precedence Health Services, the Hume-Whittlesea Primary Care Partnership and local councils to identify service gaps in the Mitchell Shire in the provision of diabetes services. Following the program management cycle, a needs assessment has been conducted as part of the diabetes diversion program to guide the provision of the project we have been assigned. Due to the above average admission rates, particularly to the Northern Hospital for diabetes-related complications, this project focuses on decreasing this number and improving the outcomes for people living with diabetes. By improving the provision of medical and allied health services to people living with this condition, there will hopefully be an improvement on diabetes management and care across the northeast of Melbourne. We have mapped out a plan on how we are going to conduct this project over our placement, including a goal, objective and strategies. Here are the goal, objective and strategies that Crystal and I have drafted for our project. For our strategies to be implemented, we will complete a mapping of diabetes services in the Mitchell Shire. This will include identifying which services general practitioners refer their diabetes clients to, as well as what services each of these allied health or diabetes-specific providers offer to these clients. To gain opinions on the effectiveness and breadth and ability to access these services, we will hold focus groups with these clients. Our results will be disseminated to Nexus through written reports and resources which can be provided to clients on services available for their diabetes management, depending on their location in the Mitchell Shire. Our project will also guide further projects as any gaps in diabetes service provision can be reviewed. The social determinants of health are important to consider when assessing the needs of the community. This includes how their socio-economic status, employment and residential environment and inclusion in the local community affect their ability to access health services. In our project, we will be taking these into consideration to improve and encourage management of type 2 diabetes through guiding improvement of service provision. We will apply effective communication theory into the implementation of our project, particularly during focus groups with the community. The questionnaires that we have created to our focus groups are easy to understand to ensure people from all educational levels can participate. It will also be important to facilitate discussion by involving everyone and adapting to unique methods of communication. This includes responding to verbal and non-verbal cues such as tone of voice and body language. Another important consideration for effective communication includes being clear about the intentions behind our focus groups and how information gathered will be utilised to benefit participants. The main focus of our project is to ensure that a client-centred approach is adopted throughout. In our project, we will be gaining community perspective, ensuring their needs and wants are heard. When making recommendations for future change, we will ensure to respect individual preferences and diversity to promote equitable services to all people living with type 2 diabetes. I have included a rough timeline for our project to ensure that we are achieving our goal and objective in a timely manner. During week 2, we will complete the mapping of services and finalise the questionnaires for the focus groups, which will mainly be conducted in week 3. The final 2 weeks will allow for the compiling of results and finishing our report. Our results will also be communicated to the team responsible for the Diabetes Diversion Project. Thank you for listening.